So I think we start. Good morning, everyone. It's a pleasure to see you for the third day of the conference. I'll be your moderator in the first 90 minutes. And this is a topic very dear to many people. It's at the same time a difficult topic in many respects, and it's a beautiful topic: spiritualities and psychedelics. Ideally, I will have a very minimal talking time today, and we have um, great speakers coming. But what we don't have, unfortunately, is Roland Griffiths speaking, because Roland Griffiths is not in a state where he can even do a remote talk. That's why we asked Professor David Yaden, who is planned for the symposium anyways, to take over part of his time. And now, before we start into the topic of spiritualities, first, one or two remarks from my side, and then an introduction of the speakers, obviously. Like with many people who enter the interesting field of psychedelics and psychedelic therapies, the philosophical or the philosophical spiritual side of the field was always of great interest to me. But you see, by myself using the word philosophical, I also have an attitude. I have myself developed an attitude of a critical review of what people do with spiritualities. This is something I would like to get into our conversation about spiritualities, and we will look at them from a theoretical point, but also with our colleagues from the ZI Mannheim and the Mind Foundation and Charité. We will take a look at patient quotes from interviews that we have. What do people do with spiritualities? What do they do in their lives? Which behaviors are they initiating, changing? Which kind of approach behaviors or avoidance behaviors are situated around spiritualities? Is this healthy, what people are developing? What's the role of the psychotherapist or even ourselves as friends of people who have a psychedelic experience? All these questions can be debated today. So, can I ask the technicians, is Professor David Yaden online already? Yes? Wonderful. So in the first 1.5 hours, we'll have a presentation of David Yaden. Then we have a brief question and answers. And then we will invite Dr. Andreas Weber to give a talk. And then we'll close the first half with a panel. And in the second 1.5 hours, we'll have the presentation of patient quotes that are somehow linked to existential experiences, to philosophies. And we will talk about how that can be interpreted, how we deal with it in psychotherapies and everyday life. It is my pleasure to introduce to you the two speakers of this morning and the colleagues who will be accompanying the dialogue about spiritualities from their expertise as psychotherapists and psychiatrists. So before I introduce David Yaden, I would like to introduce the others briefly so that you know who is also on the expert field. Then I'll introduce David Yaden. So I'll start with Professor Timo Storck. Timo, would you come quickly and tell the audience who you are, what's your background?
Good Morning, everyone, from my part as well. My name is Timo Storck. I work as a professor for clinical psychology and psychotherapy at Psychologische Hochschule Berlin, and also work as a psychologist and psychoanalyst in private practice. And in my research, I am interested in meaning formation in psychotherapy. And that's what I'm going to try and comment the talks we hear about.
Thank you very much. Yeah. So, second colleague with a lot of experience also in providing psychedelic therapy and thinking about the meaning of spiritualities in these therapies is Sandeep Nayak. Sandeep, would you present yourself with a few sentences, your background?
Hello, everyone. I'm Sandeep Nayak. I'm a psychiatrist at Johns Hopkins, where I work on a variety of trials of psilocybin for various psychiatric conditions. So happy to talk about a range of different types of indications and the ways in which these topics arise clinically.
Thank you. So we'll introduce the others in the second part of the symposium. And now it's my pleasure to introduce Professor David Yaden, who is a professor at the Johns Hopkins Center for Psychedelic and Consciousness Research. His research focus is on psychology, cognitive neuroscience, psychopharmacology of spiritual, self-transcendent, and positively transformative experiences that might be triggered by psychedelic substances. So, David, so far I have no contact with you here, but I hope that you could hear what we were saying, and you're invited to give your talk. Well, let's remark, I think it's 4 o'clock in the morning. So, David.
Yes. Thank you for that introduction, Henrik. Can you hear me? I can see you at the podium there.
We can hear you very well.
Oh, good. Yes, well, I apologize I can't be there in person. I have a newborn here, but it is indeed 3:30 in the morning, so it's bright and early. I'm glad that you can hear me. I'm very glad to be here speaking virtually on this important topic. So I want to begin by noting a new initiative in the field sparked by Roland Griffiths and taken up by him after his terminal cancer diagnosis. So if you look at my affiliation, you'll see that as of a couple of months ago, I'm the Roland Griffiths Professor of Psychedelic Research in Secular Spirituality and Well-Being. I want to say a few words about what secular spirituality means in this context is particularly relevant to the proceedings of this particular symposium. So when Roland received his terminal cancer diagnosis, his priorities shifted in his personal and professional life. Professionally, he came to realize ever more clearly that the most interesting aspects of his research, the outcomes that interested him most, had to do with findings related to the meaning of the psychedelic experience, its spiritual significance, belief changes related to psychedelic experience, and then also persisting changes to well-being, both in terms of mood and attitudes about oneself and one's life. Now, there's this strange word, secular, which is another word like spirituality that means many different things to many different people. So I think spirituality, for some people, is associated with religious doctrine and is virtually equivalent to religion. For some people, spirituality means something non-doctrinal and vague, but nonetheless dualistic and supernatural, a kind of new age spirituality. And for others, like Sam Harris, for example, but I could cite many examples, spirituality is entirely naturalistic and atheistic and has to do with feelings of connectedness to other people and the world. So spirituality means different things to different people. Secular does as well. For some, secular means the exclusion of the supernatural or religious or spiritual aspects. And so it might seem like a bit of a paradox or a tension to put secular and spirituality next to one another. That's not the sense that's intended here. What's intended is secularity as a kind of standpoint or container. For example, our government offices are meant to be secular spaces in the sense that they allow belief systems of all kinds. They're pluralistic in the sense of allowing any belief system, but not abdicating one in particular. So the idea here is to study all of these senses of spirituality, but from a secular standpoint, not prioritizing one over the other. So let me say a bit more about what I mean there. You can see my speech accepting the great honor of this chair and the mandate to study these topics online. And this is a quote from a recent article. Just reiterating what I just mentioned, that there are indeed different senses of the term spirituality, ranging from religious to atheistic and many gray areas in between, and the importance of conducting unbiased research on these beliefs that doesn't prioritize any particular belief. So I'll say much more about what I mean there. The other thing is to note that these topics attract a massive amount of misinformation, as if it wasn't hard enough to study psychedelics from an unbiased scientific perspective. When you add in topics like spirituality and well-being, we know from social media influencers, the range of statements that are made on these topics is dramatic. And so bringing in scientific and critical thought into these domains that attract so much misinformation seems to me quite important. And that's the mission of this professorship. So a little bit more about where I'm coming from. Like Sandeep Nayak there, I'm a professor at Johns Hopkins in the School of Medicine, the Center for Psychedelic and Consciousness Research. I should note that in that context, in the context of my medical research colleagues, we're often advocating for the value of studying psychedelic experiences and their potential in the therapeutic domain, with colleagues who are generally extremely skeptical of this work. And so when we are in this medical research context, speaking for myself, I find myself advocating for the value of this research against a very skeptical group. However, that's not always the case. When I'm giving talks at conferences like this, I'm often seeing a lot of enthusiasm for psychedelics. And so the roles switch, and all of a sudden I find myself to be in the skeptical position. And so I wrote a paper about this dynamic writ large. It refers to the psychedelic hype bubble. And so I think that we've seen, after periods of exuberance, many decades of extreme skepticism, drug war propaganda against any value of psychedelic experiences whatsoever. And this is a non-evidence-based perspective based on alarmism. And over the past few years, as we all know, we've seen some super enthusiasm. We've seen, especially in the media and perhaps driven by industry interests, but also from some researchers, this super enthusiasm, which goes well beyond the benefit. So I think it's important that we remain evidence-based in our claims generally, specifically with psychedelics because of this pendulum swing or hype bubble dynamic. But the same issues apply on the topics of spirituality and well-being, and maybe particularly as they pertain to psychedelic experience. So a bit of an outline here of what I'll talk about, some background, discuss psychedelic experiences and how they relate to belief changes, and end with some clinical type concerns. So first, the background. I think it's important to note that the kinds of experiences that psychedelics give rise to, as well as psychedelic use itself, has been varied and across historical contexts. But here I'm mostly referring to non-psychedelic experiences that seem to share a similarity to the kind of experiences that psychedelics tend to give rise to. We see evidence of such experiences in every religious tradition, and in prehistory, in ancient Greek history, up to the present day. And so what do I mean by the kind of experiences that I'm referring to? Here's an example. Someone reportedly feeling themselves at one with the grass, all of nature, and feeling the satisfaction of losing self in a perception of supreme power and love. This could easily come from a psychedelic experience. However, this is a Christian woman describing feelings of rapture. And we see experiences of this general kind in most of the world religious traditions, historically and up to the present. However, we also see experiences of this kind reported in books that are very different. These are books all penned by well-known atheists, or maybe agnostics, but mostly leaning atheistic. Bertrand Russell, Sam Harris here, Alain de Botton. There are similar experiences described here, but the interpretation of the experiences is quite different. These experiences are not interpreted as belonging to the realm of revelation or providing support for a supernatural worldview. They're rather described as experiences emanating from the brain, but also tending to have great interest and value attached to these experiences, despite this difference in interpretation. So here's just another example for you to take a look at. Here's Bertrand Russell describing a kind of mystic illumination. He describes this in his autobiography. He says that ultimately he determined that the experience had delusional elements that he came to discount. He did actually find that the experience benefited him for the rest of his life, despite him believing that it emanated entirely from his brain, finding that it brought a kind of closeness to his acquaintances and his relations, and also informing some of his passion and devotion for his life work in pacifism. So there's a concept called bracketing put forward by Husserl, which I feel is undervalued in its use for our purposes. The idea with bracketing is to bracket in a kind of emphasis on the subjective experience and the phenomenal qualities. And this comes from the study of phenomenology. So to focus on the experience itself and to bracket out the interpretations insofar as it's possible to do that. There are deep and interesting scholarly and philosophical questions that may, in some contexts, be empirically tractable, having to do with the extent to which you can really bracket out interpretations from the experience, or whether these color and flavor the experience itself inevitably. But I feel that this is useful as an attempt, and you can get quite far with attempting to do this, to separate out how the experience felt itself versus one's interpretation of it. So to bracket in the feeling of the experience and to bracket out the interpretations. And this is the approach advocated by William James in what I think continues to be a highly relevant and important book, The Varieties of Religious Experience. I'm curious if, by show of hands, how many people have read this book. If you could raise your hand if you've read this book, I'm very curious. I can't actually see you, so I'll have to text Sandeep to see what percentage of the audience raised their hand. So let me say a few things about why I think this book is important and what William James advocated here. First is the emphasis on personal accounts. So rather than simply an armchair consideration of these experiences, he went through and looked at the actual evidence, so people's descriptions of these experiences. He also maintains throughout a methodological agnosticism. You don't know until the last few pages of the book what his own beliefs actually are about these experiences. And he keeps those as personal conclusions rather than professional ones. And so maintaining this secular standpoint or methodological agnosticism has, I think, tremendous value. Outcome-oriented, so looking at what flows from the experiences and emphasizing these outcomes. Henrik mentioned this in his intro. And then evidence-based, finally, looking to the data, gathering the data, and prioritizing the data on these topics. While these topics seem exceptional in the sense that they're highly valued and important, I don't think that they are outside of the purview of the scientific method. And I think we should indeed be leveraging the scientific method to the extent that it's possible. We can look at people's reports and descriptions and their behavior, while we may not be able scientifically to adjudicate the real truth of any metaphysical beliefs or interpretations. This is a book that came out a few months ago from myself and my colleague Andrew Newberg, where we basically attempt to get people to read the original, to read William James's book, and to carry forward insights from that book and review research over the past few decades in psychology, neuroscience, and psychopharmacology on these so-called altered states of consciousness. And we reiterate the points that I just made in this book. A bit on terminology, so I just use this term, altered states of consciousness, which is problematic, I think, because it's so general and vague. I work in a psychopharmacology lab that studies a lot of different drugs, and my colleagues will say, well, each of these different psychoactive substances results in an altered state of consciousness. So what do you mean by altered state? In the psychedelic domain, people are often referring to a psychedelic type experience when they use altered state of consciousness. James coined a number of terms and phrases like stream of consciousness and timeline and others. He comes close to coining the term altered state of consciousness, but he uses forms of consciousness and normal waking consciousness. So at one point, James seems to refer to these experiences in this extremely broad way, as you see here in this quote. But elsewhere, he uses the term religious experience or mystical experience, as you see in the title of the book. I think he does this for reasons of communication. Talking about forms of consciousness is quite abstract, where his readers would be familiar with terms like religious or mystical experience. James does something else that I think is very important, which is he differentiates various aspects of religion and spirituality. So as soon as he uses this term religious experience, he says, what I don't mean by religious experience is the doctrine, the practices, the affiliation, the sociological aspects of going to church, the theology of the beliefs. What I mean specifically are the experiences that some report. And again, he's attempting to focus on the experience while bracketing out the beliefs or the interpretations. And so again, I think this is valuable and a useful way to proceed. He did gather data, and so you see here some very early data gathering on kinds of experiences that people report. These will be non-psychedelic experiences, but you see some of these experiences are culturally constructed, likely in the sense that they're unfamiliar to us. Spontaneous awakening, determination, these are terms that are not common. However, you also see other categories which are quite common. So a sense of oneness, you see here back in the 1890s being asked about. And so this rudimentary work by William James's student Edwin Starbuck that you just saw has been followed up by very large-scale polling companies like the General Social Survey and Gallup. And so here's a sample from the US and UK asking, have you ever felt as though you were close to a powerful spiritual force that seemed to lift you out of yourself? I'm curious if those in the audience would guess what the percent endorsement of this is. So people, how many people do you believe said that yes, they have felt as though they were close to a powerful spiritual force that seemed to lift you out of yourself? So pick a number in your mind of what percent of the population you think has endorsed this question. I'll give you a moment to do that. So once you have a number in mind, just raise your hand to indicate that you have your guess pre-registered. Okay, so there is an answer here. Sometimes psychology can actually provide specific answers. So in this case, there's 40% endorsement here of this particular phrasing. Now, the phrasing has changed over time. It's been administered in many different ways, but it's been surprisingly stable. So ranging from 30 to 40% or so of the population endorsing a variety of questions of this general kind. Like this one, for example, having a profound religious experience or awakening that changed the direction of my life. This one by Gallup, very similar rate of endorsement, as you'll see in a slide or two. This raises an interesting cultural consideration. In the DSM, we see certain quotations like how hallucinations can be part of a normal religious experience in certain, quote, cultural contexts, or in some cultures, having experiences, religious content, here described as a hallucination, is a normal part of religious experience. Well, one wonders what culture they're referring to when you see here's Gallup data over decades showing that the rate of endorsement of having had a religious or mystical experience is quite high, about a third of the US population over many decades endorsing this kind of experience. So you just saw some single item questions, as we call them. Scales tend to work better in most ways because you have a number of probes and you're not relying so much on the wording, one particular word, and one's personal connotations with that word. You get a question asked in a variety of different ways. And so you kind of begin to identify a latent construct that is measured in a more robust way. There are also problems with many existing scales in this area, though, as they don't emphasize experiences. They mix in beliefs and interpretations. And this is an issue. This is a problem for this field in general. I think that we could do more with our methodological agnosticism and more bracketing out interpretations to the extent that we can. If you look into this area, you'll find that in the literature, there are a number of different terms that are used in this context. I've written on self-transcendent experience. We'll see that mystical experience is used widely, oceanic boundlessness by some, ego dissolution. There's quite a lot of terms in this area. For the book that I wrote, we chose the term spiritual experience simply because most people endorsed that that was their preferred term when we asked them. So it is the most common term, as you see here. And actually, mystical is quite more of a rare term when you ask people generally about this general type of experience. However, if you do a subgroup analysis of the data, you'll see different things for those who are believers in supernaturalism or a god, as opposed to those who are considered non-believers, who are naturalists. And you see different preferences in terms of term. And actually, self-transcendent does quite well. So I've been mulling over that as a term that we might talk more about. Also, awe. So both religious and non-religious seem to be okay with that term. Okay, so getting a bit more specific about these experiences, when we look at various triggers of these kinds of experiences, we see right in the middle the psychedelic substance. Actually, we see it right between being near death, so near-death experiences, and childbirth. This is something I recently experienced, at least close by. But we see psychedelic substances are part of this common list of triggers for these kinds of experiences. This is the kind of distribution that I hope that we can begin to show more of. This is, again, more general kinds of experiences, not just psychedelic triggered. But what you see here is that for some people, hospitalization was needed, for some, a lot of therapy, and for others, a little bit of therapy. And so it's important to constantly reiterate the risks and adverse events of these experiences, and that by no means are they all positive. However, it's also important not to fall into pathologization of these experiences. The Freudian perspective was very pathologizing towards these experiences, and I think that view persists amongst some, maybe many psychotherapists and in the normal population. Many people don't want to talk about these experiences because they're afraid that they'll be branded as suffering from a mental illness. So we need to balance our ability to speak about the very real adverse events and negative experiences, but not falling into a pathologization. And even more than not pathologizing, I think we have to acknowledge that many people indeed indicate that they're positively impacted by their experiences. Not all, though, right? So we see some strongly disagree that the experience was positive. So that's part of the distribution. But we also see many strongly agree. So I think we need to learn as a field how to communicate the shape of these distributions, and perhaps find good analogies for the risk-benefit profile of these sorts of experiences. And then the reason why ultimately I went from studying psychology topics that were more generally related to well-being to this topic, you'll see that many people endorse that the experience, which was generally less than an hour, impacted their life for many years. It's very uncommon to find positive experiences that have this lasting impact. So you see in factor 2 here, mystical unity, feeling a sense of oneness with all things. This tends to be what's prioritized and emphasized in psychedelic research, and also in research more generally on experiences of this sort, which we might call spiritual or self-transcendent. However, there are a number of other experiences that are reported at quite high rates, both in psychedelic and non-psychedelic contexts. Aesthetic experiences, revelatory, feeling voices or having visions, synchronicity, feeling that events have a kind of meaning, and even God experiences, which can be had, by the way, by people who don't believe in God. They have an experience that they choose to interpret in a different way. When we do a factor analysis, we find that we can decompose a number of, when we ask people about these experiences, we find a few subtypes. These are by no means comprehensive, but most of the time, if someone says, yes, I've had a spiritual experience, it probably involves either God, unity, or a entity or ghost, a spirit of some kind, which is surprisingly common in the normal population. So there is a deep scholarly debate here that's worth noting. And so there is the view of perennialism, which is that these experiences that I've just mentioned occur across history and across culture and are virtually the same across all of these contexts. I think that we can easily reject naive forms of perennialism that were popular decades ago in the 60s and 70s, for example. It's very clear when you read accounts of experiences across culture that there are genuine differences, not simply superficial differences in language use, but there are genuine differences across cultures and across history. And we need to be mindful of this, to not paper over real diversity with a kind of single view of how these experiences go. The other extreme of this discourse is the idea of cultural constructivism. And this is the idea that experiences are entirely different across culture and that there are no similarities whatsoever. And I think that we can safely reject this as well. There's been very interesting cross-cultural work on pain, showing that pain is a human universal, and rejecting the notion that pain is universal has very dire consequences in medical ethics. While the stakes aren't quite as high here, I think that it's simply similarly naive to think that there are no similarities of these sorts of experiences across culture whatsoever. And so there is this common core view put forward by Hood, which still leans a bit more perennialist, but tries to find some common ground. In my book, we describe a view called the common clusters model, which we think forms even more common ground between the constructivists and the perennialists, and ultimately provides some empirical pathways forward for us to sort out the similarities and differences, which is indeed a project that we're undertaking at Hopkins in collaboration with Harvard, called the Archives Project, where we're gathering experiences, mostly psychedelic to start, across cultures and history. If you're interested in this project, please do email me, and we can add you in as we're opening some aspects of the project to community help. So focusing now on psychedelic experiences more specifically, we do have a real problem with the measurement of the acute subjective effects of psychedelics. I personally think we're fairly early on in this endeavor. There's room for improvement, and I predict that the scales that are used now will not be used 5 to 10 years from now, and my hope is that we'll have far better scales. Here are some examples of the kinds of scales that we have right now. The mystical experience questionnaire is one, challenging experience, the altered states of consciousness scale. So the first two, the mystical and the challenging experience scales, are used at Johns Hopkins primarily. the altered states of consciousness scale used in Switzerland, and I think across much of Europe. Eco-dissolution inventory, often used in the UK. Other scales, including one by myself, the Awe Experience Scale, which I developed with collaborators in California at Berkeley. But really, we use all of these scales all of the time. And while I think each of them, including my own, are problematic and ultimately won't be used in 5 to 10 years, I think that some of the criticisms of these scales are also quite superficial. They're picking up on something. And I think it's important that we continue to refine and to understand what exactly they're picking up on. What is the latent construct that they seem to be identifying? Just a bit of a note here. Again, I think it's just important to continue to reiterate that challenging experiences do happen. Adverse events are real and abuses have occurred. So this is one study. This is not a representative sample, important to note. That is something that we're doing right now. But in a survey of people who reported challenging experiences, 11% reported putting themselves or others at risk, and 2.7% reported getting medical help. And again, adverse events do exist and abuses have occurred. I just want to make sure that I've mentioned these. And I'll continue to reiterate that. And Taves is a religious studies scholar who has made the point that it's important to expand our notion of the acute subjective effects beyond feelings of unity, which can be quite limiting. We've started to do this a little bit at Johns Hopkins. We now ask a wide variety of questions. Here you see examples of psychedelic and non-psychedelic spiritual type experiences, and looking at the extent to which people felt the presence of God and different aspects of what God means in this context. And a similar study for DMT entity encounters. And so I think we are continuing to expand the scope of our measurement of the acute subjective effects of psychedelics. And that ultimately, my hope is that we move as a field into an iterative factor analytic process, similar to how the personality models like the Big Five were derived. And that I hope that this is collaborative and includes both quantitative and qualitative methods that are being pioneered and beginning to be applied in the psychedelic domain. I think network analysis also provides an interesting opportunity here. And so my colleague, Michiel van Elk, is doing important work in this domain. Eiko Fried, and I hope to be working with Michiel van Elk on this project in the very near future. Let's see, before I move on, there's just one other thing I want to say here. So usually I include some correlational scatter plots of the various measures that are commonly used now: the mystical experience, altered state of consciousness scale, ego dissolution. And it's just to say that they're virtually identical. Despite their different theoretical backgrounds, they're basically measuring the same thing. And I think we need to take this quantitative psychometric reality into account when we critique these measures and we say, oh, one is so much better than the other. I don't think there's much grounds for that, frankly. I think they're basically more or less the same thing at this point. Okay, some words on belief changes, and then I'll wrap up in the next few minutes. So there was a debate a few years ago, which seems like a long time ago, but not that long. So Eddie Jacobs from Oxford wrote a piece for the Scientific American, "What if a pill can change your politics or religious beliefs?" He didn't pick this headline, by the way. This was the editor. But myself and Matthew Johnson found the headline concerning and somewhat alarmist. And so we wrote that there's no good evidence that psychedelics can change your politics or religion. And we thought that people would take from the headline this idea that if you take a psychedelic, you have this pretty good chance of coming in an atheist and turning out a Christian, or vice versa, or coming in a Republican and coming out a Democrat. And there's simply no evidence to support that sort of thing. There is some scattered evidence of subtle shifts in beliefs. And since then, Eddie's view has been supported a bit more in the literature. So Chris Timmerman found in survey study, as well as in a clinical trial context, that psychedelics altered some metaphysical beliefs. So for example, this idea that there's a separate realm or dimension associated with supernaturalism. They found that the psilocybin group indeed increased in their non-physicalist beliefs to a small degree. You see also, though, that the SSRI group increased to a smaller degree. And while this is a significant difference, it seems like if the SSRI group is increasing in their non-physicalist beliefs, this may point to something about the context of the study itself that's leading to these changes, or perhaps an interaction with positive changes in affect related to beliefs. But regardless, there's a delta here in the increase that's worth attending to. Sandeep Nayak has also worked on this topic in a cross-sectional self-report survey, looking at a number of more granular metaphysical beliefs, such as dualism, spirituality, and mind perception related to various objects and entities and creatures. Found that these views increased in all but superstition in this cross-sectional survey. So this was more concerning to us. It looked like there was more evidence of psychedelic belief change. However, in a prospective longitudinal study, which is available online, pre-printed, there was no evidence for change in religious or atheistic affiliation, and the changes in mind perception to things like inanimate objects is so small as to be virtually negligible, certainly not clinically significant, but still of genuine interest. And I continue to think that it's important to get the facts in this area. So it seems as if certain contexts seem to be an important active ingredient to changing beliefs, whereas other contexts, we don't see these belief changes. As you see here, from baseline to 2 to 3 months after the experience, there's virtually no changes in terms of believer and non-believer status. And so in conclusion, some clinical concerns that I'll raise. So the World Psychiatric Association does actually say that it's worth discussing a patient's religious and I would say spiritual beliefs and practices. So this is not something that is inappropriate to discuss. In fact, it's encouraged. These are important beliefs and values and meaning-making structures for people that it's worth to bring into the therapeutic container. However, there should not be proselytizing, so pushing one's beliefs or worldview, and here secular is used in the different sense, not as a pluralistic container, but as relating to more atheistic views. So we shouldn't be pushing religious, spiritual, or atheistic beliefs on patients, and I would add study participants. Also, so some believe that spiritual experiences by their nature lend themselves so automatically to a non-physicalist or supernatural interpretation that it's impossible to talk about psychedelic experience in terms other than this sort of religious, spiritual, or supernatural way. But I think Chris Letheby has pointed to very sensible and simple ways of understanding psychedelic experience and discussing them from entirely a naturalistic standpoint, as changes to self-awareness specifically. And I think Chris is right that this provides another option to talk about these experiences. And so some notes about this that I mentioned in my book. I think that clinicians should not promote their own metaphysical beliefs on participants or patients. And by the way, this is not exceptional to psychedelics. This is just general practice. I can't think of a context in which I would not hold this view. Yeah. As well, William James provided a really important set of guidelines and a spirit of methodological agnosticism, which I think that we can carry forward in our research. We should be studying these topics scientifically. They are really important in terms of human sense-making, well-being, behavior. We need good data on these beliefs and how psychedelic experiences relate to them, but a methodological agnosticism is indeed possible. So with that, I want to thank my fellow faculty at the Center for Psychedelic and Consciousness Research, to note that we are engaged in a faculty search. We do have postdoctoral research fellowship opportunities, and I invite you to reach out with criticisms, comments of this talk. So thank you.
Thank you, David, very much for this comprehensive introduction into our topic. Now, I have one concern. If we follow the initial plan to have a question and answers, we will spend 3 hours on question and answers. So I'm inviting you to keep all your questions in mind. I have 20 myself. and to maybe invite the second speaker, which I personally forgot to come to the stage before. Andreas, could you come? And the idea is now the following. We have had an introduction by somebody coming from the therapeutic, from the clinical field with a strong background in philosophy, obviously. You can't talk about these spiritual experiences without that. But now, not everything related to the spirit, to spirituality and psychedelics comes from clinical work. And that's one of the reasons why we invited Philosopher of Biology. And I'm looking very much forward to your contribution, Andreas. But since I forgot to introduce you, could you say a word about your background and then take off with your presentation?
Okay. Yeah.
So we'll discuss David's contribution and Andreas' contribution in the panel that we have together with the audience.
Yeah. So this I use this just to forward my slides. Wow,
Yes.
Very good. Yeah. Good morning, and thanks, Henrik, for having me here. And well, I started as a biologist, and but also took an education as a philosopher, and I ended up as a writer, basically. So I'm writing books about the idea that the reality is not simply a material collection of objects with the strange human experience of being, of having meaningful experiences, but it is actually alive and experiential to its core. So that's what I'm trying to do and what I'm trying to find. I have been trained with cognitive scientist Francisco Varela in Paris, and have published together with him. So he's my dear teacher, and in the following I'll show you some of his concepts as well. And he was also a Buddhist.
he was a Buddhist following the Dzogchen transmission line by Tulku Udgyen, very famous Dzogchen Tibetan Buddhist teacher. So what I'm going to do here now is to actually, building on this research, on these experiences, trying to argue for, or entice you into seeing that actually life and living experience of being alive, your experience of being alive already is psychedelic. And I try to prove this with some biophilosophical arguments, but I also want to just first invite you into this. So just have a look at this little scenery. So I'm sure many of you will at least a little bit have had some emotional reaction to this picture of the fragile and limited, soon ending summer in the wings of this little lichenid butterfly on this beautiful flower. And this emotional reaction of yours is already part of what I call realizing your own living existence in terms of a psychedelic experience of mutual transformation, and also an experience of unity to which you access on an emotional level, on an emotional plane. That's your reaction, but there's also something which you can observe in terms of what is going on ecologically, namely the flower which is transforming its body into the butterfly by feeding him, and the butterfly who is giving fertility, who's giving offspring to the flower by pollinating the flower. So you have the shifting of shape from one body to another, which is also a psychedelic experience, a very profound one. It is, for me, you'll see in the following, I'm a fan of butterflies, actually. They're very important for me, but not me alone. You see this very interesting etymological connection in Old Greek, where the word for butterfly, psyche, is also the word for soul, and it's also the word for breath. So even there, you see there's a profound insight into the knowledge that our experience of the physical world leads us into our inner understanding of our connection to the physical world. And you see some more of these pictures. Just to remind you that what we'll be talking about, what I'm talking about is actually our daily experience. So this is a nice Apennine spring meadow in May. And you again probably have this feeling, oh, how nice would it be to lie in this meadow and maybe meditate or kiss, what you do in these spring meadows, or eat it like the cows do in this meadow. And again, what you see here is a situation in which one body feeds the other body, and this brings about this diversity and this beauty and this enticement we feel in our souls to somehow become part of this. And I would even say that what we perceive as beauty of nature, as our civilization calls it, is the realization that we are part of this interconnected, mutually transformative network of feeding one another. And as we have heard here in this conference several times, psychedelics enhance this nature connection feeling. So it's actually an enhancement of this understanding of being in a sort of, how could we call it, commonwealth of mutual breath. So I want to stress this, want to explain this a little bit more in depth. So these are my little didactical drawings. And just to tell you what is in depth going on between these different inhabitants or participants of ecosystems. So you see the bumblebee and you see a little flower, and not only, so before I explained you the situation with the butterfly and this other flower as a sort of mutual fertilization, but what actually happens in depth is that we breathe one another. Because if we eat something, if you eat your breakfast of this morning, it is transformed into your body. And then if you breathe out your body, which then feeds other beings. And this is a fundamental ecological situation. So what you see in these, what you see when you, what you even experience here, what you experience when you are among other bodies is always a moment of shifting your shape from yourself into the other and of being fed by the other. Even now when you just turn your attention a little bit to your breathing, you can realize that when you're breathing in the bodies of the persons who sit with you. There's no way around this. The only way around this is to stop breathing. So you have this realization which, without thinking, of a profound biological link, chain link from one body to another, which is actually a sort of continuity, a sort of flux between the bodies. So we could even say that on a material level, we are one huge body, which somehow gives rise to these individuals, which we understand ourselves, but only in a sort of perspectival way, not in a fundamental way, not in an absolute way. And I'll come to that. I come back to that a little bit more specifically. I want to show you that how much this is based on the work of my teacher, Francisco Varela, with this little first lines of a famous article of his, where he talks about organism as a meshwork of selfless selves. So he pursued this idea that we can understand organism only if we understand us, every being, basically as not being an autonomous, sovereign self, but being a self only from the perspective of building ourselves from the matter of others. It has been enigmatic for a long time that he was talking of selfless selves, but it also has this beauteous background of the experience of the selflessness of the world. And I will try to connect this somehow in the remainder of the speech. So the underlying thought, maybe I'll give you this as a little bit as a guideline. The underlying thought in this is, oh no, sorry, we're not. This is the problem when I use my own computer as a manuscript, and it's here, and I'm forwarding the slides on my computer and not on the big screen. Okay, so there's this legendary and difficult article about the selfless self. So the idea is that we can have our subjective experience only because we are continuously remaking ourselves from other bodies, through other bodies. So only because our body is in a total continuum with the rest of the world, we are given our perspective on our experience as somehow being a center of concern of what is going on. So there is an interesting dialectics, and there is also a condition. So only because the world is distributed and shared, we are able to have a perspective on it. So it's not in this view, it is not a contradiction between these two perspectives, but it's actually a condition. Only because the world is totally shared and distributed, we can have a personal perspective on it. And I show you another little, here it is, a little diagram, which illustrates a little bit this term, the famous term of autopoiesis, which many of you might have heard, which has been coined by Varela and his elder collaborator, Maturana, in the 1970s, when they argued that a living being needs to be understood as a circular process which recreates itself from the surrounding, from this incoming matter, from this matter which is eaten and breathed through others and from others, and then is worked into this process of keeping up an identity, and thus creating this perspective, but always being dependent on other, always being dependent on being in this interlinked chain of being in continuity with the rest of the world, with the remainder of the world. And I show you this. Oh, it's here. Go a little bit quicker. I want to show you this again in a sort of scientific way. This is the Krebs cycle, which is the main metabolical cycle in our cells. And just to make you understand that this old idea of living beings somehow taking food, taking stuff in and burning it like a motor does is actually not that which happens in an organism. So the classical idea which you learned in school, or which was somehow suggested when we learned this in school, is that we are machines which need fuel and then burn that fuel, and by the energy which is generated by burning this fuel, keep on going. And what you can see here is, like in the upper left, when you see that it's in German now, food comes in, it becomes transformed into a carbon compound in this citrate cycle, in this fundamental metabolical cycle within the cell, and becomes part of the organism. So what you take up as food becomes your body, literally. And then by breathing out, some parts of this body are released as CO2. So this is actually your body which is released into the air. And this is, so to speak, the biochemical argument for this view that bodies are not firm containers, they are not machines, they are nothing which is just completely closed into itself, but they are processes which run on what they are not. So in being alive, you all the time incorporate what you're not, you become what you're not, and you give yourself away into others. And this then yields this experience of being in this profound emotional connection with others. And let me see where I am. I want to try to link this in, like, maybe the last remaining minutes, 5 minutes. I want to try to link this profound openness and this profound emptiness which comes about through our metabolism, and which has this existential emotional dimension in our experience, as I tried to show you with this, in the presence of this butterfly scene. I want to try to link this to the Buddhist idea of the ultimate ground of reality. I want to make these connections to show you that there is an interesting parallel, actually, between this view of organism as being a continuum that nonetheless creates the perspective on itself through this continuum, and the very old traditional Buddhist ideas of experiencing the ground of reality, or you could also say the nature of the mind. They say the nature of the mind, which is in Tibetan, it's Rigpa. It's the experience of the nature of the mind. And when the Buddhists say mind, they don't mean mind in terms of, like David Chalmers would use it, like in terms of the mind, which is somehow in a not so well understood way related to our physical brain. They refer to the world as such, which is always experience and matter. So this nature of the mind has, and I put there the Sanskrit and the Tibetan terms, is shunyata, means it is full of emptiness. It is empty of self. And there is lalita, which is playfulness. So reality, the ground of reality, is always bringing forth newness. It's always creating something. It is playful, like the first apple blossoms in spring are playing with the light and are playing with fertility. And there is this third very important word, karuna, which is very often translated with compassion. So this is actually the activity of giving. I would translate it as the activity of giving. So the nature of the mind, the basis of reality, is full of, or is actually made of, it is an activity of giving. So that is the, let's say, the Tibetan setup. And then I'll read this and I'll explain it a little bit. And I want, just as a suggestion, I want to try to map these on this idea of the organism I tried to sketch before. So an organism is empty. And I think this was relatively clear in these explanations because it has no fixed material substance. It has no kernel, it has no center. It is continuously passed through by the world and gains the perspective of being an individual only temporarily. So we are in this continuum. And this continuum means that ultimately an organism is empty of self. Ultimately, experientially, it is a perspective, but ultimately it's empty of self. But then, or maybe just to go back, it's the part of emptiness, the part of shunyata. If you look at certain branches of cognitive science and philosophy, and activism, which has been founded by Varela, is relatively common. So people say, okay, yeah, we really basically don't find a self, but and we can work on this. But now I want to go beyond this and show you that we have also the other two in organism, and it might even become more interesting. So lalita, playfulness or luminosity, is something which the ecology, the biosphere, life always yields. And this is part of your experience of this fascination, of this deep aesthetic attraction, of this sensual closeness, of this desire when you see the spring blossom in this meadow that you somehow want to roll in it. And so there's a profound meaningfulness to the ground of reality, which is part of the ground of reality revealed by life. And then karuna, the way to give, which might be the most challenging argument I suggest here on that, has to do with this twist of self-creation of this perspective of meaningfulness, which happens in the continuous flux of matter which goes through the organism. Because if there's a continuous flux of matter, it could also be just matter, just somehow rearranging itself. But in organism, we have this desire, we have this need to build this center, which then always recreates itself, which always gives itself to itself from a desire to create life, or from a desire to self-create as aliveness. So there is a profound level of desire to give life to yourself at your own center. I would call it this, a desire to give life, which forms your own center as an organism, as an own being. And it is the center which forms the center of all beings. And the title of this little talk, which is about to end, Bodies of Love Processes, has to do with the idea that on the level of this flavor of the ground of existence, which is the desire to give life, we are actually within the experience of love, because love is the desire to give life. You know that you're loved by a person when this person shows you that he or she wants you to be alive, wants you to stay yourself, enhancing yourself, growing as yourself. So that's a profound experience of receiving love. It's a good checkup, by the way. Also, if somebody tells you, I love you, and then you see, am I actually given aliveness or not? So this is the core of being an organism, which reforms this this individual self on the matter which rolls through it. It's a sort of desire to give my life to myself. And to my eyes, this is our fundamental experience of being. It's the fundamental sweetness in our hearts, which we know, which every being knows, is that we are given life through the center of our bodies, which is empty, which is just the desire to give life. And going into this desire of giving life, we arrive at the center of reality as well, because reality is this ground which longs for creating individuality, for giving life to individuality. So you could also say that this experience of sweetness of existence, which is given to myself, is a profound psychedelic experience. Or you could even say love is a profound psychedelic experience. And then it also sounds kind of familiar. Like being really in love is also profoundly psychedelic, shape-shifting, body-changing, and connected. Thank you.
So, thank you. Thank you very much, Andreas and David. Can I ask our panelists, our 5 panelists, to come to the front and take a seat? So, panelist number 1, of course, is David, who hopefully hears us. Then Sandeep and Timo, Storck and Andreas Weber. And of course, our 4th panelist is the pot of flowers that we have here. And hopefully we'll get the one or the other answer from it. Yeah? So we have a little bit less than 30 minutes and we'll improvise a little bit. And what's strange about this panel is the moderator will leave the panel in between because he's moderating another panel. So we'll leave it to life, to what's going to happen afterwards. Okay. Yes, now. Yeah, so this is what you can do with the topic of psychedelics. You can build therapies, you can form theories about it. You can also do natural philosophy with them. So I'll start before we try to connect both with a very a little bit crude question, simple question that is very related to what David also said. Why are psychedelic professionals not shamans? I'll take it from there. You can also, of course, you can contradict myself. You can contradict me. But why are psychedelic professionals not shamans?
Can I start?
Yes.
Well, what is a shaman? A shaman, typically understood, is an individual who engages with unseen forces to provide a variety of services, including healing, divination, sorcery, witchcraft. I think some individuals who use psychedelics do consider themselves shamans, bill themselves as shamans, but in the context of typical clinical usage, it's not, particularly with medicalized psilocybin, where the notion of dysfunction or illness is construed as an individual psychological problem. It's much more appropriate to use a psychological or medical frame for it. Not to say that there are not many people who do use alternate frames.
Timo, so Andreas, in his wonderful talk, gave a natural philosophy that he related to the psychedelic experience, even saying that we are all in kind of a psychedelic experience all the time. I never thought this is some kind of shamanism, no? But is there a space for life philosophy, for a practice of philosophy in in the practice of psychotherapy?
Well, first of all, I want to thank both presenters for their rich talks and then answer the question. What I was thinking of, especially during your talk, Andreas, was isn't the consequence of viewing each experience and perception as psychedelic that only those people need psychedelic substances that are in some way blocked or impoverished in their direct access to perception? So, following the question, maybe we're all shamans, except when we're not. And when we're not, we need to become them.
Yes.
Yeah, I'd like to add a little bit. So thank you for that little feedback. I mean, a shaman is somehow privileged in helping to access this dimension in a way. So he has been trained, and he stands in contact with, as you say, with the invisible forces, or with the, let's say, with the not materially present side of this reality. So with the soul side of this reality. So in a way, only if you practice to have this stable connection to the experience of this dimension, you can call yourself a shaman. And this is also why so many modern shamans are not really shamans, because they don't have this stable connection. And when I say stable connection, then it is obvious that although we are in full psychedelics all time with every breath, we do not realize this automatically. And this is a really important question. So we could say, actually, why do we not see this? Which then is, at least if you follow let's say the Paris school approach, which I showed a little bit here, which obviously is happening. Why are we somehow excluded from understanding what reality is truly about in most moments? And why do we need so much practice to go there? And it's actually an open question for myself. What is actually, why is this happening? Is this necessary to stabilize the subjective experience, which then is necessary to allow these subjects, which we are, these individuals, to survive? Is this necessary? Is this the price somehow for individuality? Or is it not? Could it be different? And I'm trying also to experiment with this, to go deeper into this non-self experience. But it is clear that we cannot do this automatically in a stabilized way, I'd say, at least not in our culture. And it's important to see this.
I try to direct the question to David Yaden. I hope he hears us. So two sentences before that. So in 1996, I attended my first psychedelic science conference. It was organized by my later doctoral supervisor, Rolf Veres, who is sitting here. And obviously, it inspired a lifelong interest in psychedelics and psychedelic research and the puzzling topics around it. But at the same time, it also inspired some kind of confusion and anger. Like a lot of people were presenting their stuff in a very uncritical way, like presenting them in a like priesthood-like way. They themselves creating the idea that they are shamans, that are somehow superior to others in the field. So if David hears what I'm saying, so
yes, I'm here.
Yes. So are you familiar with what I sensed like more than 20 years ago? And from your point of view, how should we as professionals deal with these tendencies in the field to construct ourselves as priests or shamans? Or
Yes, I think Sandeep's point about the definition matters quite a bit here. If we're talking, if we're using the term shaman as a sort of religious professional of a certain sort of small-scale society, then it's sort of easy to say why we as scientists and clinicians aren't shamans. There's a extremely general sense of the term having to do with anyone who works with altered states of consciousness in any lasting and meaningful way. And so I suppose people probably use this term in different ways, but I appreciate, Henrik, the example that you gave of the tendency in psychedelic research conference spaces for some people to adopt a kind of preacherly or shamanistic kind of mode, as if they have direct access that is revealed to them that others don't have access to. You know, I'm just coming from Oxford, where I gave a talk on psychedelic exceptionalism, and I want to make sure I'm not falling into it here. I mean, of course, every field has its charismatics and its people who will adopt this kind of aloofness and arrogance and charisma, that they know the truth. But I also think we have to admit that psychedelics appear to draw it more than some other fields. Nick Langlitz, who's an anthropologist at the New School, is working on charisma as it pertains to psychedelic spaces. And I think that he's probably right in that psychedelics draw it more than others. There's simply a lot of unknowns and a lot of uncertainty that we simply don't know about. And there's a lot of fascination inherent to psychedelic experiences. So it's fertile ground for people who are prone to trade on charisma to set up shop in this sort of field. And so while I don't think it's unique to psychedelic contexts, I think we as a field need to be on extra, we need to take extra care about this dynamic, in my view.
If I could add, there are many aspects of psychedelics that are not unique to psychedelics. And in the vein of individuals setting themselves up as priests, spiritual leaders, charismatic figures, you also see this, for example, with the introduction in the 60s to the United States of Hinduism and Buddhism by a variety of charismatic figures who introduced not only a very interesting new cultural framework, spiritual practices, probably benefited a lot of people, but also sometimes a cult-like environment that led to antinomian tendencies, that led to all sorts of abuses, including sexual abuses and financial, etc. And so you are going to see that anytime you have a spiritual practice that goes by different rules, it's relatively unbounded by ethical norms. It then kind of depends on, well, what framework are we talking about? I think with medical or scientific practices, the ethics are very clear. We should not be doing this. But this isn't a field, it's a topic, right? There is no field of psychedelics. And so I suppose we need to pin down what exactly we're talking about, but.
Can I add? Yeah. So in my experience and personal experience, the center of this, let's say, mystical path, which is also opened by psychedelics, is egolessness. And it's egolessness in the experience that life is given in this incredibly, unbelievably sparkling way. So egolessness is the center of it all. So it's what it is about. But on the other hand, what we can see in spiritual traditions, and then also in how you framed your question, because obviously that is a problem, that there were these priest-like figures in early psychedelics, that as soon as there are special experiences, I feel myself entitled to see myself somehow as somebody special who has the power to go there. And on every traditional, profound spiritual path, this is why there is a teacher to tell you that this is nothing worth at all. So this is why you need a teacher who tells you, be modest and lose your ego. And so it's the same thing. It happens and it's wrong. And it's the clear sign that you should not follow somebody who has this posture, because he will not be able to bring you there where you truly will enter into this compassionate giving from a source which is without ego.
Thank you, Andreas. So strange things happen when you talk about psychedelics and spiritualities. For example, you'll lose your moderator now, who is handing over the microphone to my colleague, Marvin. So in the architecture of what we do, we have 10 minutes. Maybe you also want to integrate one or other question from the audience, and then we'll follow with a more down-to-earth, patient, quote-oriented question. How do spiritualities, perceived spiritualities, appear in psychedelic therapies? So I say goodbye.
It's somehow leaving your own party, right?
Oh. No, I'm not.
Leaving the guests with a fridge full of champagne.
Okay. I think you can hear me. Yeah? Are we good? This works. Okay. Hey, good morning, everybody. I just came down from the philosophy track. Now, speaking of the potential pitfalls of following a guru and a leader in spiritual practices, especially with the involvement of psychedelic substances, did I get it right? You suggested that following a charismatic leader can only go so far in a healthy way, up to the point where the person says, I have nothing to teach you, it's about your own experience, that you need to develop your framework around, or that you come to wisdom?
No, I said that a true teacher must have overcome his ego. If there is ego left, he cannot teach you. It's impossible. He will just somehow bring you into a relationship of dependency. Maybe he or she can teach you only that far. This is why it is so difficult to find a good teacher, a true teacher. And it's crucial. It's absolutely crucial. And this is why actually it is good to go into what we call nature, because nature is egoless. This is why people go to nature and find the teaching about egolessness and about giving life in nature, because it's egoless. And so it's wonderful. But in order to accompany you on this path, it's also good to have a human. But if he or she needs to have left his ego, and it becomes more and more difficult, I think, in our times. If you look around to all these gurus, they're big egos. Don't go there. It doesn't help. I didn't get the question. No, it's a very short question. You ask if is the guru complex related to masculinity. Yeah, well, most are men actually, but I would say it's human, and it's our contemporary narcissism. So it might be kind of more prevalent in masculinity, but it's not entirely gender-based, I'd say.
I'm thinking about something. In my view, we've been circling around in various ways in the past few minutes, and even in the two talks we heard, and that is the role of death. Because I was wondering what makes psychedelic experience different across various cultures. And when you were talking about egolessness, and when you were talking about bracketing out something, I was thinking that maybe in that kind of immersion we talk about, when we talk about psychedelic experience, aren't we bracketing out the fear of individual death? Because we can talk about nature and giving life by breathing out, but especially in Western culture, we are concerned with individual death, maybe in a more severe or anxiety-driven way compared to other cultures. So I wanted to ask the audience and the fellow speakers what you think about the role of fear of death, or the fact that individual life ends for psychedelic experience and immersion?
I think it arises frequently in psychedelic therapy. Frequently meaning not all the time, but a fair amount, where people have experiences of dying or fearing that they will die. And the navigation of that ends up being quite important and often relies on certain kinds of emotional skills that are generalizable. Even if that was not at any point a specific focus of preparation or what have you. So I think it arises frequently.
Can I also say something?
Please go ahead, yeah.
So to me, the experience of egolessness, the true experience, is a death experience. It is a death experience. And it is a death experience in terms of understanding that death is different than we fear it from the perspective of Western culture, like switching off the light. It is not like this. And it's basically the experience of existing in this continuity without personal ego, but still with a perspective on what is going on, which is profoundly meaningful, which is a death experience. And so I'd rather say that going there, which is difficult and which might be frightening, but going there is able to change our society's neurotic fear of death as the end of a sort of cherished object, which is very important. It's very important for an ecological consciousness, for change, to understand that life is somehow cannot end in a way, but your ego ends and must end.
If I could respond to that. I mean, that's quite a strong claim. And just sort of adopting a pragmatic, empirical attitude towards this, many people who take psychedelics, for example, high-dose psychedelics, may have an experience of ego loss where they feel that they have died. They may also have an experience where they don't feel that they have died, or that their beliefs towards death have changed or have not changed. So while this may happen frequently, it's certainly not universal, and it's certainly not necessarily true, I think.
I think it's, this microphone is now. I think it's also, one second, just a comment. I think it's also worth debating the boundaries between these ascribed concepts of ego dissolution, oceanic boundlessness, ego death. I think it can also get quite blurry. But we have a question from Andrea.
I actually would like to not ask a question, but just comment on that. I've been an emergency doctor for several years, and I've signed around 200 death certificates, been around people dying quite a lot. And I can assure you the only death experience is death. Mm-hmm. So to me, what people experience in these spaces might go very far, but there is a functional difference between somebody actually dying and somebody coming to a state where he can be very close to the experience of ego death and so on. And what I can say is that I've seen it in others and myself, that having psychedelic experiences is very helpful if you are with people undergoing this death experience. Mm-hmm. Because you learn to hold space in a way that otherwise you might not be able to, and able to stick it out, even though it's very challenging.
Yeah, thank you. I could respond, but I don't want to sort of like pull this into a certain direction, because I'm very grateful for this. Thank you very much.
Yes, we have the time, please.
Yeah,
Go
can
ahead.
I do? Okay, so it's really lovely. We got to this point. So you're absolutely right. I agree. I haven't been there, obviously, because I'm sitting here. But then it is also important to see, and now I come back to this biological observation, that our embodied existence is a continuous death process, because we are dissolving, we are being eaten, and it is not it is not this sort of death, which is the end of individual movement, and you're dead, and you go into a coffin, and people mourn, but it is still a death. And to me, it is very important to see that, that transformations and threshold crossings are a functional condition for life to continue. So we are familiar with death processes, and we are familiar with taking a perspective which is not the perspective of our ego. So our body takes a perspective in many respects which is not the perspective of our ego. And I think it is very important to infuse this back into our idea of what does it actually mean to be alive. And of course, this is not death in terms of certificate, but it is also death. And it gives us knowledge about this. And then if you look at reports from people with these profound mystical experiences, they tell you that they were somewhere where they didn't know if they were dead or alive. Even my teacher, even Varela, and you can even find it on Vimeo. Some accounts would actually closely before he died of liver cancer, like weeks before he died of liver cancer. He talked about his experiences with his teacher when he said, I was there completely without ego. And when I had this liver transplant some years later, I was there again. And somehow it was actually, I was indifferent if I would live or would die on some level. So he kind of ventured there, and he took this experience with him. And what he always held was this level of something extremely blissful and soft, which was related to this. And he said it feels like home. And I mean, he was a cognitive scientist. And so I think we should really see that there are doors into this experience which help us to understand so much more about this and about the other side of this door, which is our continuous being born in every moment. And we should explore them.
I think we're bracketing out David. He unmuted himself.
Yeah, thank you. Yeah, interesting discussion. I want to bring this back into the empirical domain to some extent, and to pick up on Marvin's comment about what do we mean by egolessness exactly in terms of what people say and how we can measure it. There does seem to be a common acute subjective effect of egolessness that's clear that people can vary over the course of a day, and of course in extreme experiences on this dimension of what we might call egolessness. But I think it's important to situate it in this measurement paradigm so that we don't overstate it. There are a number of acute subjective effects associated with psychedelics that contribute seemingly to the therapeutic benefits. And egolessness is not necessarily the dominant one, or even the top several of those candidates. For example, feelings of connectedness and egolessness are often taken to be two sides of the same coin, and they are indeed highly correlated, but they are differentiable. And any time that I've seen in the data, when you differentiate egolessness and connectedness, connectedness is doing much more of the work in terms of therapeutic benefit and effects on well-being. And so in some ways, the emphasis on egolessness, while interesting and while relevant and important, I don't think is necessarily decisive or even maybe the most important of the acute subjective effects that lead to lasting beneficial impacts. So I just want to bring these other concepts into the conversation and lend a kind of empirical perspective.
Right, yeah, thank you for that, David. Also talking about spiritual practices, shamanic practices, of course, these are also deeply connected, mostly culturally embedded in large cosmologies, right? So this is not necessarily only about, so you took it back also to therapeutic change, and I would like to bring it in the domain of meaningfulness, existential questions. I think this is also partly where you were going, and a depth of connectedness in life because you feel like you've seen the other side. How do you think, should this be integrated in practices, medically or not medically?
Sorry, should what be integrated into?
So how deeply relevant do you think, beyond looking at therapeutic changes, would be such near-death experiences or transcendental death experiences in psychedelic practices outside of the medical context for meaningful lives? That's still unclear.
Or maybe it's difficult because I think some topic of our panel is how can we have psychedelic experience like in any perception or any conversation with others or any process we enter. And that's what I find interesting because I think a lot of people from non-Western cultures would have trouble answering the question, how do we integrate psychedelic experience in everyday life? Because it is in everyday life, like Andreas mentioned in his talk. So if I understood your question correctly, it is what can we learn from psychedelic experience, or how should psychedelic experience be part of anyone's life? And I think Andreas's talk gave kind of an answer to that because, well, looking at a butterfly can be a psychedelic experience in terms of learning something emotionally about yourself, about others, or about life. So I think it's more of changing your mindset to everyday experience than using these extreme experiences we've been talking about in the past few minutes. I think we don't need near-death experience to lie in a meadow and have a good life.
Mm-hmm. Yes, I can support that. We have a few more minutes. Yes, there's a question here.
Yes, hello. I have a question about the role of, let's say, wisdom, experience, knowledge, which is not evidence-based. So as professionals, we cannot be missionaries, but should we be obliged to offer our patients contact to wise elders, whoever they are, in terms of integration, if there is the need?
I can speak in the capacity as a clinician. So these things come up frequently, right? People have spiritual experiences. They may have experiences that alter their metaphysical beliefs. Even transiently, they have questions, right? They have many, many questions. And if you occupy a clinical frame, I think the ethical framework is very clear. You should not impose your own belief system, but you also should not necessarily impose other belief systems that you think might, I don't know, complete the person's quest or what have you. Just with a non-psychedelic clinical encounter, people may also have these types of questions. You may help them explore them in a relatively, non-directive way, but the hope is that you're not infantilizing them by giving them the answers for things that are ultimately very, very personal questions. So I don't think that we need to reach for a separate frame of practices, a separate frame of ethics. Just approach it again. And once you step out of the clinical frame, things become very murky. So I'm going to choose to bury my head in the sand and not comment on those.
Yeah, I saw you first, and then you next to him. You next to him.
Thank you. How would you, sorry, were you first? Was that for you?
You'll have your turn. It's okay.
All right. No worries. It was in line, so you couldn't. All right. Thank you very much. I would like, probably especially David, if you could comment on psychedelic therapy for the terminal ill. So people who are facing death, end-of-life anxiety, for people who know they will actually die. How does the role of their spiritual beliefs or religious beliefs change in importance closer to death in combination with the psychedelic therapy?
Yeah, the end-of-life context is particularly interesting, and it seems somehow resonant with aspects of the psychedelic experience. Actually, that was the direction that a lot of the researchers were planning to take, is this end-of-life context, and we're guided to approach larger diagnoses because of the potential impact, positive impact that could be had on them. This is a domain where there are not a lot of great psychotherapeutic or psychopharmacological tools available that provide what we might hope. If you think about how you would ideally like to die, it's maybe not the most pleasant thought on a Saturday morning. But if you take that thought experiment seriously, what would a good death look like to you? That vision, there's been studies on this, tends to not align very well with the actual lived reality, so to speak, of how people actually die in our contemporary society. For example, people generally want to be able to review their life and the meaningful moments, to have some degree of lucidity, to have a connection with friends and loved ones. However, the physical and mental pain experienced during this time often prevents those things, those valued experiences from occurring. So there's a great deal of suffering here, and it's worth considering how we can improve it. And psychedelics, for some, may be one of those tools. I think that there's actually potential there. And when I do this thought experiment myself, I am very open to the possibility that if it were possible, a psychedelic could open me in a time when it's very easy to close down. But there are also great risks. There are always risks with psychedelics, as I've tried to reiterate, and those have to do with risks to well-being, but also epistemic risks. As Chris Letheby has talked about, we can sometimes we see people adopt beliefs that they otherwise wouldn't. And in my mind, the stakes are raised in this end-of-life context because there's perhaps less time to integrate those beliefs. So we don't want to consider someone being brought into a state of deep confusion that would increase their suffering even more. And of course, during the end-of-life process, metaphysical beliefs and views on existence come to the fore, so people will be actively processing. So all of that's to say, I don't know the answer. I do think, though, it should be studied so that we can quantify this risk-benefit ratio and eventually transparently and clearly communicate the risk-benefit ratio to individuals who are deciding whether or not to engage in this sort of treatment. I think there are real risks and I think there are real benefits, and I do think it's a context that is worth studying much more deeply.
Thank you for this very to the point position. Do we have a direct comment in the group, or shall we move to the next question? Yeah, next question, please.
Okay, so I'm not sure if you're familiar with the concept of spiritual bypassing. Nodding, thank you. So I was wondering, because psychedelic experiences seem to be a fast track for some people to spiritual awakening, and it seems to have good effects for well-being of some people if you have a connection to faith your own belief system, whatever that is. But then for some people, there's the danger that it will serve as just another form of avoidance, of engagement, connection, and so on. So I wanted to ask you if you can comment on this very complex problem that psychedelic experiences seem to also evoke that kind of phenomena.
You said you were addressing David or the group?
Whoever, no, whoever feels like this is their forte.
I could say something. Maybe David wants to say something as well.
Oh, go ahead and I'll speak after you. Thank you.
So yes, that's a real danger, and it's sort of a little bit. It's the same category of finding the wrong teacher in a way. It's a real danger, but well, let's say the danger is to try to avoid the necessary painful work which comes up when you make these experiences. I'm not familiar enough with psychedelics to be able to tell you from the inside, but I know from, let's say, from a spiritual path that inevitably, if you go there will some profound pain come up, and this needs to be somehow worked through or suffered through. And spiritual bypassing means that you only take the nice bits and you try to ignore this. And if it doesn't work anymore, you go somewhere else and you try to consume the bliss and not to go to the truth where it somehow points you. And I know that psychedelics bring out also the deep work. So it's sort of like your decision to take it or not to take it. And then again, a good guide helps. A good shaman, a good teacher helps. And it's an offer to you. It's an invitation to go there. And it takes courage. But every true spiritual path takes incredible courage to really lose this which holds you back, I'd say.
This might sound silly, and I'm not a fan of the person, but it just came to my mind. Terence McKenna said, take it, but take it easy. David, please.
Yes. So with this question and with some of the belief-based issues that we were discussing earlier, I think what comes to mind for me is the importance of not only in informed consent, but in the preparation process to very directly address these issues so that participants or patients or just people engaging in these experiences are not surprised if these dynamics come up, if they find themselves quickly changing their beliefs, or if they find themselves all of a sudden entirely devoted to a spiritual path that they were previously uninterested in. I think if these possibilities have been discussed ahead of time, it increases the likelihood that they will be more wisely integrated afterwards. If in the therapeutic context, for example, or really any context, a guide can raise with the individual, look, remember we talked about this. Remember we talked about how this is possible. Might we consider the possibility that your current preoccupations are related to your experience? And I think if these conversations are ongoing, if they're happening at the consent process and the preparation process, then they can be maybe ameliorated much more effectively in the integration process if these are ongoing, and that no one is surprised by this possibility. I think this again fits into this idea of how can we most transparently and simply and clearly explain the risks and benefits. And I think what you're raising is a real risk that's worth considering and communicating about.
If I could add a little bit, just speaking purely anecdotally as a clinician working with people in these types of trials, one thing that doesn't get discussed all that much is that in the days or even a couple of weeks right after the session, you sometimes see somebody who they are almost trying on new types of beliefs or new ways of thinking, some of which get discarded. And and I would say this is not necessarily the norm, but in these cases, I've sometimes had the troubling sense that if I just tap, just give a little push, I could actually goad this person to settle into maybe a kind of way of thinking that they otherwise would not have. And I also think that kind of in naturalistic use, you'll see that people will sort of engage with new social circles. And that will kind of be a way where that can be for good or for ill. But I think ultimately, people should be helped to make intentional decisions, not necessarily rapid or rash ones, and trust that with respecting people's autonomy and giving appropriate support, they can make good decisions. But we should certainly not be making those for them, I think.
Great. Unfortunately, we have to move on in the program. We have another leg of the symposium ahead of us. Well, I would like to say a couple of words more organizational. I'd also like to give you a chance if any of you has a final remark, including David. I'd like to pass it back to you in a moment, but of course it's not obligatory. Good. So this has been the first half of our Spirituality Symposium. I would like to bring to your attention this wonderfully designed questions box that you're all most welcome to enter your naive or not so naive questions that we'll address today in the afternoon at, I think, 4 p.m. or 3:30 here in the auditorium in an audience interaction. We'll place this next to the door. And please know this exists, and we'd like to have your questions for this afternoon. Now, before moving on, does any of the speakers and participants want to say something? No? No? Good. David.
Sure. I would just invite all of us to take seriously the, I think, ethical obligation to speak from the evidence base whenever possible as it pertains to psychedelics. This is a topic that attracts extreme statements routinely, both extreme positive and extreme negative, but in both cases, really beyond the evidence base entirely. And when you add well-being and spirituality into the mix, it's like pouring gasoline on the fire. And so what I would advocate for is a great deal of care and for popping hype bubbles and misinformation, challenging misinformation whenever it crops up in the wild. And so that would be my invitation and my plea. But thank you for having me.
Thank you. Very important word of caution. A round of applause. Affiliated with the Mind Foundation, with Charité Berlin, with the Central Institute of Mental Health in Mannheim, who will now present qualitative data from interviews with patients in the episode Clinical Trial. The four of them are Christopher Schmidt, Henrik Harder, Luca Färber, and somewhere in this room, Hannah Dressler. If you guys could introduce yourselves a little bit where you are, and then I would like to give the word directly to you to start your presentation. Yeah?
Hello, my name is Luca Färber. I'm an ethicist and a psychologist. And for about 1.5 years now, I'm working at the Central Institute of Mental Health in Mannheim in Gerd Gründer's group. And I'm a researcher in the episode study. Yeah.
Hello, everyone. I'm Henrik Harder. I'm still a master's student. Before studying psychology, I was kind of very manually working with pharmaceutical ingredients in their production as a shift worker. So I'm happy to be in this new field. And yeah, Christopher.
Yeah, hello everyone. I'm Christopher Schmidt, and I'm also a master's student currently at the University of Trier, finishing my master's studies, and I'm very privileged to conduct these qualitative interviews with the patients from the episode study together with my colleagues. And I cannot see Hannah Dressler here. She escaped.
Hannah escaped. Is this on? Yeah, this is on. Hannah escaped, but I think we can start without her. She'll have the pleasure to introduce herself a little bit later. So, guys, I leave it to you. Yeah.
Hello. All right. Thank you very much, and welcome to our presentation, Spiritual and Existential Themes as Experienced by Episode Psilocybin Trial Patients. Today we want to give you examples of experiences of patients in the episode trial, and especially have a look into spiritual and existential themes and how different patients interpret different experiences differently maybe. And we are also going to investigate the concepts of Frankl and Yaden. So again, we conducted these interviews with patients from the episode trial, and you heard about this trial yesterday already. It's a German psilocybin-assisted therapy trial with 144 patients. And patients were suffering from treatment-resistant depression, and every patient at least received a one-time dose of 25 milligrams of psilocybin. We conducted qualitative interviews, especially with open questions and also questions concerning psychotherapeutic processes. You heard about those in Max Wolf talk already, psychotherapeutic mechanisms of change. But also spiritual and existential themes did come up in these interviews, and we also asked follow-up questions sometimes. And also please note that we do not intend to make any statements regarding quantitative measures. This is an exploratory investigation here. And we do not want to draw conclusions regarding specific clinical outcomes of a patient here, regarding a specific experience that might have led to a clinical outcome, although we provide the Hamilton Depression Score, but this is rather context information, and we're going to have a look at some examples here. So again, spirituality is a very broad concept, and as we heard already, definitions may vary to a large extent. And so we focused on patient reports and quotes that in that the patients themselves refer to the experience as spiritual, or some related concepts like mystical, or mention God or religious. And we also investigated quotes that refer to experience that could be measured with some instruments like the Mystical Experience Questionnaire or the 11-dimensional altered states of consciousness scale, for example, unity experience, without the patient explicitly stating that it's a spiritual experience. Okay, we start with the first part and the question, how is the occurrence or absence of spiritual experiences described and interpreted from a patient's perspective? An exploratory look into different configurations of prior attitudes and beliefs. And when you look into these experiences, we asked two questions. One being, do you have to be a spiritual person to have a spiritual experience? And there we looked at patient reports of patients who did not report a spiritual background or beliefs, or stated that they were atheist or non-spiritual. And the second question would be, does a receptiveness towards spiritual experiences necessarily result in encountering one. So we looked into the patient reports for those kind of questions. And maybe it's also good at the beginning to clarify that there were also patients without spiritual experiences and without formal spiritual beliefs that still benefited or reported benefits from the treatment, but this is not the focus of this presentation today. So we start with the first patient example, and this patient reported alleviations of symptoms for a period of time after 2 weeks after the dosing sessions, but then he reported also that symptoms were coming back again. And referring to the dosing session, he reported, I felt very much at the center of what was happening, and in the preparatory talks or in what I had read beforehand, the word great connectedness or something like that was used, which could be applied. To the question if he developed any positive use to him or the world, he reported, the world is still the same as before and I am also the same as before. And to a question regarding the integration process, still referring to his experiences, he reported, yes, well, I mean, what you experienced there is, I used to work in a clinical environment, so what you can play on a person's sensory organs when you inject them with something, I think I'm relatively familiar with that. So note that this patient also had a very much biological understandings of the mechanisms of action of psilocybin, and one could assume here that he did not attribute a lot of meaning to this experience. Maybe a different example of patient, and this patient described feelings of heightened connectedness to the world around him prior to the therapy trial. Again, experience that could be interpreted as spiritually meaningful by some people. And to the question you said you were experiences disconnection, did it occur in the therapy as well? He replied, yes, a little bit in this positive vision that I spoke about, where I was in this kind of womb as a fetus and surrounded by nature. I also have this experience when I'm alone by the sea. Well, not always, but I can then have that. I practically experience myself as a small part of the whole world, as part of the ecosphere. When considering the patient's own take on these experiences, it would not be considered spiritual, although they would maybe even score on some subscales of some psychometric instruments, as he stated. And then people often asked whether it was a religious experience. Because I had already come to an end with religion when I was a teenager, it was not a religious experience for me, but it can certainly for people for whom the spiritual has a reality. So for me, practically from a philosophical, scientific point of view, it has no reality, nor do I see a metaphysical spiritual level, but for people who don't reject it for logical reasons, it can certainly be a positive experience in that regard. So here we see the interpretation of the participant again. And I think one could assume that his background plays a role for him. As he stated, it was not a religious experience for me as I come to a religion, to an end with religion. Yeah, I think so. Okay, but we also see reports from patients for whom these experiences maybe have triggered a change in their approach to spirituality. Some examples we see now. And to the question, did your understanding of your life change? He replied, a small part, I would say. Before I was completely scientifically rational and well, not religious anyway. But to the question if this had an impact in everyday life, or maybe one before, he also stated that in the dosing session, that it was somehow clear that everything, well, is more or less directed and that in some form one would still exist independently of one's body and that not everything was somehow makes one is just a neuron storm. Well, I haven't completely discarded that. I say that is at least a fraction of it left and maybe a little bit, well, not hope, but something along those lines that maybe you will get into the state when you're no longer alive at some point. So maybe we can see a change here. But to the question if this had an impact in everyday life, he responded, so interesting, in everyday life, actually no influence, no, but maybe also quite good, because if If I think that's what's waiting for me when I leave this place, maybe that's not the right approach either. Yes, so interestingly, I think we see a new, maybe a little bit a new sense for spirituality, so to speak, but no reported meaning, at least in his everyday life. But we also have seen and interviewed patients who report that their new feelings towards spirituality became a resource and are connected to better life quality and alleviation of depressive symptoms, as this patient here. And she reported meeting a universal force somehow. And yes, I think it also gives me security somehow. Yes, also gives me security. And I listened to a lot of music afterwards to connect with it again and again. She also reports changes. I do believe that I'm perhaps more open, so I have a bit more of connection to the cosmos, so to speak, somehow like this, what I mean by the mystical somehow. I had that, so I was just never particularly spiritual, and I think that's already now a bit more. And to the question if she could report more details, she reported, yes, it's not that I do anything, but I already have the feeling more. I somehow have the feeling that there could be more, and that there is a force that somehow also guides you. Or maybe that also protects you or something, so it's also a kind of more basic trust. And she also elaborated in the interview that this basic trust resulting from this experience was helping her to confront her problems connected to her depression, and that was a good thing. And close this part of this presentation with another example of somebody for whom this reported new sense of spirituality became a resource. And that was an extreme experience and went so far that I suddenly had the feeling that everything is one, and I could fully understand that. And I came into this study as someone who is clearly an atheist and has nothing to do with spirituality and such things whatsoever, absolutely nothing. And to suddenly be confronted with such topics so strongly that it is part of one's own identity, very much part of it, was very difficult for me to integrate. And the following statement refers to a period after the dosing session. I felt connected to my soul, I would say. During the second experience, I was able to feel that I am more than my body, that we already know from research that this ego is constructed ego, that is coupled together in the brain, and that is also the reason for all the problems. And once this ego has been pushed aside a bit, then you realize that there's so much more behind it, and I identified with it so much that I felt very free and somehow also responsible over the next few weeks. So what can we maybe take away from this? As we see very different interpretations of those experiences. Maybe the background plays a role in some patient in interpretation of some experiences, but also some people seem to experience or interpret those experiences in a way different to their former beliefs, and some belief changes seem to occur. And also we see some people for whom those spiritual experiences became a resource, and also in their view connected to some alleviation of symptoms. And I now hand it over to Hannah Dressler.
Hello, my name is Hannah Dressler. It seems that I have just missed my own introduction when I was grabbing a glass of water outside. I apologize for that. So I am a psychologist. I'm currently conducting qualitative interviews as well with my 3 colleagues. I'm also in training to become a psychodynamic psychotherapist, and I'm very happy to be here today. Today, I would like to present some statements from patients that reported having a prior background in spirituality or religion, as opposed to the examples that Christopher Schmidt just presented that reported no such prior connection. So first, I would like to present a male patient that described having benefited enormously from the treatment, being symptom-free for the first time in 25 years. He stated that he was raised Catholic in a small town and that he had a lot of respect towards these psychedelic substances, and that he feared that this day would be one of the worst days of his life. He also stated that he had some prior meditation experience, a very diverse interest in religions, philosophies, schools of thought, and already expected that a mystical experience may occur. During the substance session, the patient describes traveling back into his childhood, being able to relive a lot of scenes growing up, facing a lot of negative emotions, and he described the whole journey as very challenging and tiring. He also describes having had an experience with God during the first dosing session, and in particular, he stated, "I also thought maybe at some point there will be a mystical experience. Maybe I'll see God or Buddha or whoever. I actually had that at one point. I had the feeling that there were a lot of lights revolving around me in the sky, and there was a light, a bright light, that looked like a tunnel, a pipe, a line going through the sky. And behind it was a bright light. And I knew there is God. And I also knew God is female at that moment. That was also completely clear to me." When we asked him if the treatment changed the way he understands life now, he responded, "I've always been very interested in different philosophies, religions, schools of thought, and I think I've been looking for a long time for a model that somehow suits me. And in hindsight, I think I was subconsciously searching for a model that somehow makes sense to me, that suits me. I still find that religion is exciting, but now I find it more intellectually exciting. But I no longer have the feeling that I'm somehow comparing it with my own living environment. So I really feel like I found my way now. As I said, without putting this path into words in any way, I try to make the whole thing more tangible for me, to describe it for myself, and that doesn't work. But I feel like I've got my way now." I now want to present another example of a female patient that we interviewed with a prior interest in meditation, in particular Buddhist Vipassana meditation. She always wanted to try, but she was afraid that she would not be able to handle sitting still for that many hours. And that is why she used the first session, which she believed to have been a placebo, as an opportunity to practice 6 hours of meditation. So she reported the following about the second dosing session, which would have been a high dose then. Yes, so in the substance session, there was all the love in the world, and I was really able to accept everything that is. And I think that's what you're talking about in the enlightened state. When you're enlightened, just being in peace with yourself and with others. She also described the experience as incredibly good, incredibly inspiring and unbelievable. For me, such experiences just show the beauty of life or of existence or the meaning of existence in general. We also asked her if anything had changed in her life due to our treatment. And she responded, "Well, as I said, there was like a catalyst for me back then. A lot has changed for me, and I've also seen, yes, that meditations, which I've always tried in vain, I have now done Vipassana. In retrospect, I only lasted for a short time, twice an hour a day, but I just implemented it differently now. So I think the experiences I had in the substance session mean that one can also have other perspectives, this comfort, love for myself and for the others, this universal love. It's such a strong experience that you, by the way, I also experienced that during the Vipassana meditation. Basically, that's what you experience when you're at peace, and that was unbelievable." This patient also mentioned that after our study, she did a training to become a yoga teacher, and she chose teachers that were also engaging with the spiritual and not only the physical aspects of yoga. So now I presented 2 cases of patients with a pre-existing interest or background in spiritual themes, but does a spiritual background necessarily result in encountering one during the dosing? So I would now like to present a female patient that we interviewed. She dropped out after the first dosing, so that means she never completed her second dosing or any further integration sessions. She reported that she came with very high hopes and expectations, and that in particular, she hoped to have a spiritual experience or an experience with God. However, the dosing was experienced as very cold and lonely. When we asked her what exactly she expected from the dosing, she responded, well, taking another look at a possible relief. So I've had some drug experience in my life. I never did it for the sake of convenience, but for spiritual or ritual reasons. And I have had experiences of God in my life that have deeply moved and touched me at times. And that's what I was hoping for, something that brings me positively over the next time. So we asked her with which other substances she has had these experiences with, and she replied that she had never tried psychedelics but smoked hash, and that she felt like in a spiritual heaven when she was smoking. And she also described that she was very busy during the dosing, so busy that she didn't want to talk to the therapists, but now she's unable to remember what exactly she was being busy with. She further stated, if this had been outside the study, I would have said, damn, a stupid trip. But because I had so much hope and thought, wow, maybe it could be a way to deal with depression differently. It was 3 times as bad. That was a strange situation, experiencing something bad while expecting something good and then saying, I'm quitting the study. So considering the cases that Christopher and I just presented, we conclude that sometimes people with no background in spirituality can experience such qualities and that their interpretations can be very diverse. But we do have some open questions as well that interests us. For example, how should we deal with patients who begin treatment with high hopes regarding the occurrence of spiritual experience or very specific expectations, which may be particularly important considering what is presented in the media as well? Do we need more research into prior belief and expectations? And maybe the term spiritual is so broad that it allows different interpretations by different people. That was my input for today. Thank you very much.
Thank you, Hannah. Thank you. Thank you. Thank you, Hannah. This takes us into the next presentation by Henrik and Luca. And just in the meantime, now the microphone is on. Just in the meantime, I wanted to check in with the audience. Are there any questions regarding understanding, or did you have a more technical question towards the presentation? We'll have time for discussion afterwards. Good. Then I think we can move right on.
All right, I'm happy to be here to talk about this because it means a lot to me. Aside from looking into the potential spiritual experiences, we also wanted to take a look into existential themes, such as described by Viktor Frankl and Irvin Yalom. And yeah, so we looked into the occurrence and the nature of these experiences. And that was guided by this question for Viktor Frankl: do patients address meaning-related aspects as described by Viktor Frankl? First, of what are we talking here? So, Viktor Frankl's logotherapy and existential analysis is a meaning-centered approach to psychotherapy and counseling. Frankl is best known for his perennial we could say, bestseller, in which he depicts his survival of the Holocaust and outlines his therapeutic approach. Let me now present two central concepts that we, by which guidance we explored and categorized these interviews. The first one of these concepts refers to meaning in life. Meaning in life means so much as in logotherapy, the meaning is not constructed by the individual. It is also not a mere perception, but rather meaning is independent of us. So meaning exists all around us. And what does this mean? This concept posits that life holds opportunities to discover meaning. And this can be discovered under all circumstances of life. And this can also mean that different moments of life could have different meanings, and also for different people. But first, these meaning opportunities must be perceived and then realized, which we as humans are always free to do, but for which we are also responsible. Yet where to look, where to find these opportunities of meaning? Frankl posits that these meaning potentials, these meaning opportunities can be realized through creative, experiential, and attitudinal values. Regarding creative values, Frankl wrote, everyone has his own specific vocation or mission in life to carry out. Well, this could be, for example, a profession or an artistic endeavor that we pursue. Gotta be frank and honest. For me personally, being here with you, it is really something special for me. It is a way of me discovering a way into curiosity and inquiry about the human nature after quite some period of disorientation and quite a few dead ends. But also meaning could be found through experiential values, such as in experiences in life, such as in loving another person, or by experiencing nature or art. Related to attitudinal values, and considering Frankl's Holocaust survival, Frankl is known for what he understood as a deeply human defiance in the face of inevitable suffering. Or let's hear it in the words of Frankl, everything can be taken from a man, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. The second concept relates to the individual human being. It posits that each and one of us possesses a will to meaning. And according to Frankl, this will to meaning is the primary motivational force. Simply said, at the core of what it means to be human lies the search for meaning. If we cannot fulfill our meaning opportunities, we may experience frustration, meaninglessness, and emptiness. Experiences that may further develop into illness. Now let's turn our attention to some exemplary statements where we see some resemblance with Frankl's ideas. The following two interview participants described how they experienced aspects of meaning seeking during their participation in the study. After the 6-week mark, after about the second session, I noticed that I somehow lacked a sense of meaning, that I just didn't see any meaning in it at all. I had even less of a meaning to what I had before, and I asked myself what my meaning in life was. And even if someone had told me, or I had read something like, you have to give life a meaning yourself, I didn't feel that at all. Another participant said, time and again, the desire to do something meaningful with my life came up. Another interview participant expressed how the search for meaning has often been with her during her depression, and then how to be confronted with a beautiful experience. I was overwhelmed by how beautiful this music was and what I was seeing, because I had very strong visual effects. I think it had something in the background that accompanied me a lot and that also very often shaped my depression or shapes it. This feeling of searching for meaning, like, is that all there is in life, and isn't there maybe more behind it? And I think that was a feeling because of that. Or maybe there is more. Music alone can be so incredibly beautiful. A beautiful experience that the participant describes as potentially meaningful, indicating that there may be something more to life. With respect to meaning in life and how one participant expressed how she understood this psilocybin experience as an opportunity to peer into another world and how it is possible to discover meaning there. I think with psilocybin, you can briefly, how should I say it now? It's like opening a window for me, like opening a door and then seeing, oh, there is another world. And if you stay with it, there is meaning, or I discovered the meaning. And I knew, okay, I have a goal, and what I'm experiencing here now, it's not the whole truth. It's not just that, it's much more. And I saw it, felt it, and feeling it was the best thing. When asked what a specific another scene during her psilocybin experience felt like, the same participant replied, it was incredibly good, incredibly exhilarating. Well, for me, such experiences show the beauty of life or existence, or in general, the meaning of existence. Here we see some correspondence with what Frankl referred to as the realization of meaning through experiential values, through experience. However, it is surely well worth mentioning here that Frankl himself was rather critical of meanings that could be derived from a psychedelic experience. During his time at Harvard, he was witnessing firsthand the, we could say, cultural disturbances during that time. And he was kind of referring to these kind of experiences as inherently subjective, potentially bypassing the true potential of meaning that life could have in store. And with that, a curious remark, I would hand over to my colleague, Luca.
Hello again. So, while Henry was working with the ideas of Viktor Frankl, I focused on a different existential approach and dealt with the question whether participants engaged with the 4 ultimate concerns as defined by Erwin D. Yaden. To answer this question, I first of all had to engage myself with Yaden's existential psychotherapy. The starting point of his approach is the idea that human existence has certain intrinsic, inescapable properties. And if we as humans are confronted with these, this can lead to existential conflicts and even psychopathology. For Yaden, there are 4 of these properties which are the most important, and those are ones we already talked about today, namely death, freedom, isolation, and meaninglessness. What I did now was to read the interview transcripts, looking for statements that I could connect to those 4 ultimate concerns, and spoiler alert, I indeed found multiple patients who seemed to engage with one or even more of those ultimate concerns during their treatment processes. What I'd like to do now is to share with you one of the participant statements for each of those 4 concerns. So let's start with the first ultimate concern, death. Death is an inevitable part of life, and according to Yaden, we typically respond to that with strong anxiety. The existential conflict now arises from our wish, or from our awareness, not our wish, from our awareness of death and our wish that we want to live on, we want to continue to be. The quote I'd like to share with you is the following. I was lying towards the window and there was a vase with 3 flowers. I thought, oh, they really could have given the flowers fresh water. One of them is hanging down. It is not even in the water anymore. You have to give it water. Then the psilocybin started to take effect. And then I realized, yes, that one flower is withering, but that's just as it should be. In line with the music, I somehow saw how everything ages. Then I also saw that my arm was there, and even though there were wrinkles and some kind of spots on my arm, I thought, it's all just fine. It's all just fine. Everything falls into place. The way I see it, this person describes coming in touch with the ultimate concern of death by looking at this one dying flower. And from there, she somehow seems to generalize this aging process onto everything that ages. As she says, I somehow saw how everything ages. And furthermore, she then seems to make a connection to herself as an aging and as a mortal being, as she sees those wrinkles and spots on her arm. But notably, instead of responding to that with anxiety, she seems to sort of adopt a position of acceptance towards her own aging process. As she says, it's all just fine, everything falls into place. Moving on to the second ultimate concern, freedom. According to Yaden, the individual is entirely free. And what he means by that is that the individual is entirely responsible for and author of their own life. The existential conflict now arises from our awareness of this existential freedom that clashes with our wish for external ground and orientation. The other way around, or what is important to know, is that for Yaden, all those things that could give us, from an external perspective, give us ground and orientation are constructions. So things as traditions, cultural norms, religion, all those things are, or ethics, all those things are constructions. And if we realize that, we are confronted with this kind of existential freedom and the necessity to take responsibility for our lives and actions. The quote I'd like to share with you is this one. I just understood that I'm completely free to do what I want in every way and that I'm only limiting myself. And that's really scary at first. I don't have to do anything. I wouldn't even have to go to work tomorrow if I didn't want to. These are all barriers I make in my head. I cannot shift the responsibility to others either. It's me. I decide, and I also must bear the consequences. If you know that, you are calmer and you can also stand by your decisions. Here we seem to have a person who really engages with the kind of existential freedom that Yaden is talking about. He realizes that he is indeed completely free and that even having to go to, or believing that having to go to work tomorrow is a construction he makes himself inside his head. And then he also comes to this aspect of responsibility as he realizes that he cannot shift the responsibility for his own actions and his own life to others. Notably, this feeling of calm, or as he states, he feels calmer and he can stand by his decisions. That's not his first reaction to this realization of freedom. His first reaction is actually that it scares him when he's confronted with that kind of freedom. The third existential concern is isolation. According to Yaden, there's an unbridgeable isolation of the individual from others and from the world. And that's also something that we touched today already in the panel. The idea is that if you become an individual, you sort of have to separate yourself. You have to detach yourself as a subject from the rest of the world to be an individual. And the existential conflict now arises from the awareness of our existential isolation and our wish to be in contact with others, with the world, with nature, and our wish to be part of a larger whole. That's the quote I'd like to share with you. I was more or less locked up in my own brain the whole time, which was a kind of black sphere. It was a very unsettling experience, very isolated, very alone. Those are feelings that I know, but not in a way that it feels so real that you feel locked up. Like I said, I was in a black sphere where you're stuck in and you cannot get out and you have no contact with the outside. This patient vividly describes the feeling of existential isolation. He is isolated, he is alone, he has no contact to the outer world whatsoever. We did also have patients who described in the qualitative interviews this feeling of unity, of connectedness to others, of connectedness to the world, and were very blessed by that or reported this being a very blissful feeling. But for this person here, that was not the case. He did not experience anything of that. He just stuck in isolation his whole psychedelic experience. Lastly, the ultimate concern number 4, meaninglessness. According to Yaden, there exists no meaning in the universe whatsoever, independent of ourselves. And that, of course, is a very different perspective than Henry showed us, which Frankl has. Frankl says there is meaning independent of us in the universe, in the world. And for Yaden, it's the exact opposite. If we do not create meaning, then there is just no meaning in the world. And the existential conflict now arises from our awareness or realization of this universal meaninglessness and the fact that humans typically are meaning-seeking creatures. That's the final quote. In the time after the substance session, I had the feeling that I'm actually fine the way I am. That I don't do what others expect of me, but what I want to do, what I have to do, where I have the feeling that this is my meaning. My meaning is not 100% there yet, but still it's a good feeling. Here I just want to underline 2 aspects. Firstly, this person explicitly speaks of his own meaning, which is independent of others. And secondly, his last sentence, at least from my point of view, can be interpreted as a hint that meaning is an active construction. His meaning is not 100% there yet, so he still might be in the very construction process. To conclude, the patients in the episode study do describe engaging with existential problems and concepts, which we demonstrated with the help of Viktor Frankl's ideas and Irvin Yalom's ideas. And if indeed psychedelics are especially able to activate existential as well as spiritual issues, then according to Politsky and colleagues, addressing these issues intentionally and systematically might be important for the future research on and development of psychedelic-assisted therapy. Thank you all for now. That's everything for me.
Thank you so much, Luca and Henrik, for the second input. As we see, this surely raises a lot of questions concerning epistemology. How do we leverage these experiences for therapeutic use? And as we see, there's also quite a degree of ambiguity. For some patients, it just doesn't help to have these mystical experiences. Now, can we use the remaining time we have, 6-7 minutes, for questions? Do we have questions here in the audience towards our speakers? Yes, please. Guys, do you want to come here to the front?
The question is about the experience of the a patient who encountered this feeling of isolation. And I saw he didn't get so much better from the treatment. And is it possible to do some integration about this, or should the patient who encounters such a fear of isolation, should he do another session where he can find a way out of that?
My opinion would be that ideally you first try to integrate what he experienced. I think from Yalam's point of view, this would be an opportunity for growth. So if you realize, okay, I experienced isolation the whole time, I was locked in my own brain, I did not have any contact to others, what does that mean? And maybe there would be an opportunity to take that experience and sort of try, to make it meaningful and see, okay, I was confronted with that, and apparently that is an anxiety that I have to be isolated. This is something that maybe even the human condition is a part of the human condition. And how can I find ways not to completely get rid of it, but to deal with it, or to find connections, to get, for example, in touch with nature. We talked about that today already, or with others in a way that sort of, makes this feeling less intense. And then, of course, one could think about another dosing session, but I think, first of all, try to work with what you experienced.
Further comments or questions?
My question is about the Hamilton scale, actually, because I was struck by the fact that the last case presented, the patient who found the meaning, I don't know, maybe it was just a coincidence, but it was the case that improved the most compared to the other patients. So my question is if you could comment on that somehow, or do you plan to analyze such data, such relationships in the study?
Actually, I do know the patient a bit, at least. I'm not his therapist because I'm not a therapist in the study, but I had some contact with him. And the last time I talked to him was like at an in-person integration meeting where he described that he still is in the process of finding meaning and of making sense of what he experienced, but still, so he is, until this day, not at 100% yet, still. But he still seems to be profiting from it and benefiting from it. And then the second part of your question, at least I would be interested in that. That's why I talked about it. I think these existential topics are something that can be very helpful, or engaging with them can be very helpful for problems that can be part of a depression. Yeah.
Now there's a chance for another question. Armin, did I see a hand there? No? I thought so. Okay, Gerd, please.
Just a comment to the last question. We have a meaning in life scale and we have the Hamilton. So we definitely will correlate these two, but we cannot do that right now.
Okay, one more question and then we're almost perfectly on time.
I will try to express myself in English, but I'm concerned about the survey of, I don't remember your name, about with patient with Christopher, with resistant depression and the spiritual orientation. If the belief is that there is no spirituality, and that person has tried several treatments and no one worked. None of them worked. And he felt, I think it was your third patient, and he felt a really nice experience, but then the fear of this one doesn't work either, because it wasn't a spiritual experience. Maybe my question is, if we orient, if we focus the integration or the talk on a spirituality, he will get more depressed or more disanimated. And if we orient the integration on the experience and on the benefit of the experience without talking about a spirituality, then maybe it could be a lift up. I don't know if I can express myself.
Yeah, I try. Yeah, I think that raises the important question on the psychotherapeutic processes, and also about also this concept of spirituality. Is also the patient have different, probably different interpretation of this terminology, and I don't know. Do you want to add something? I don't have a clear answer to the question, maybe.
I mean, addressing it at all, I think it is a very important thing. On the one hand, I think it is a very helpful metaphor of letting the patient, letting the client drive the bus. And on the other hand, sometimes the patient may need help driving the bus, not in a way of imposing on the patient's value and belief systems, but still addressing it is the first step in culturally competent addressing the situation of the certain patient. So does this help anything at all? Yeah.
And I think it's very important as well to establish a framework, because those questions or those topics, they're not just going to go away if we don't address them. It just means that the patient is left alone with them. So it's very crucial to establish a framework that is very open. But on the other hand, I think we also shouldn't advocate that these experiences are going to happen, because as seen in my case, this can lead to a lot of frustration or disappointment if that is not the case.
Thank you, Anna. That's an important remark. And we should continue to try and make sense out of the ineffable. And I hope that the symposium this morning has maybe made a few steps into ventured into some areas that are very hard to explain, maybe even harder to grasp, and yet harder to leverage in psychedelic therapies. I'm very glad that you've been here with us this morning, and we are now moving into the lunch break. I hope you found this meaningful. If you have further questions, I would like you to write them down on a piece of paper. And I think in your conference bags, there should also be notebooks and pens that you can plant and grow something, actually. Yes, you have them. And we have these boxes here that are also, yes, I see some questions, that are also placed at the Mind Info booth in every room. Today, this afternoon, we'll address them. There will be experts, or at least very opinionated people that will say something to them. Have a nice lunch break and see you later. Presenters.